Okay, so I am checking Jake Smith's order, or MAR, to ensure that there's an order for an IV insertion. It looks like there is. There's also an order for morphine, 2 milligram per ml, so we're also going to push that medication once we've done the IV. I'm going to gather all of my supplies, ensure that none of them are expired, and it looks like none of them are. And then prior to entering the room, I will conduct hand hygiene, and then enter the room. Knock, knock. Hi, Mr. Smith. My name is Megan. I'm going to be your nurse today. It looks like your provider entered an order for an IV so that we were able to give you some morphine for pain. And I will go ahead and be inserting that IV for you today. Can I verify your name and date of birth?
Yeah, it's Jake Smith, 6'2",
Perfect. And did you have any allergies?
No, I don't.
Give him some privacy here. And then I would do hand hygiene again. And then prior to inserting the IV, I would just make sure that there's no signs indicating that we shouldn't put an IV in a certain arm. And it doesn't look like there is. So Mr. Smith, do you have a preference of arm on where you would like the IV inserted?
No, my right arm's fine.
Okay, perfect. And then I go ahead and walk the spiral. Him put on gloves. Alright, let me get my items ready here. So first thing I'll go ahead and do is place the tourniquet on Mr. Smith's arm so that I'm able to find a way in. Looks like this one's going to work out well. So we'll go ahead and release the tourniquet and prepare all of the material. Twist this on, and then this is, I would flush it to ensure that it's working properly, or prime it. Yep, it is working. And then I would place this back on here. Alright. Then I would clean the site. Start horizontally, vertically, and then starting from the inside to the out. And then try not to touch that after. And then toss that. Then I would reapply the tourniquet.
Prolong it if you don't have to.
I don't like that. Okay, Mr. Smith, you're gonna feel a slight poke here. Hold down on his skin. Alright. I see blood in the chamber, so I'm gonna insert it about another 1/4 of an inch. Then I'm going to pull on the tourniquet and move the catheter so that it's flush here with the skin. Press on here to stop the blood flow, and then press the white to release that. And then attach the saline. And then I will toss that in the sharps container. And I would have already had tape pulled off, but I forgot to do that. I would tape this for the moment, just so it's secure and not moving around. And then I would aspirate to make sure that I see blood flow. And it looks like I do. So then I would flush the IV. And then as I get near the end of flushing, I will clamp off the IV. And I'm gonna go ahead and remove this tape. Ensure that the surface is completely dry, no blood, so that the sticker will stay properly.
Do you want to put a clean one under it or no? Or does it matter?
I just want to make sure I'm doing it.
Gosh, this is...
Oh, yeah.
And then I would tape this and place this across, and then place this on the side of the IV and put the date, time, my initials, and the gauge used. And clean up my mess here. All right, Mr. Smith. So it looks like your IV was inserted well. Are you having any pain right now?
No, I'm doing well.
Okay, that sounds great. So what I'm gonna do here is lower your bed and get you comfortable, and then I'm gonna go prepare your morphine IV and drugs so that we can get you feeling a little better and not in as much pain.
Sounds good.
So I'll lower your bed. And then I will be right back with your morphine.
You have to include that in the med room, as far as check the dating, medication, and verbal and do right. You mean, you do the standard of care when you go back in, but really you start down here.
All right, so I'm in the med room right now. Jake Smith, I'm going to verify. He's in order for morphine, 2 milligrams per ml. So since he gets 2 milligrams, we're gonna just give him 1 ml of the morphine. Verify that this medication is not expired. It's the right patient, we're giving the right dose. We're giving it at about 3:30 today. And it's going through his IV. He's getting it because he's been in quite a bit of pain. And I'll just ensure that he doesn't have any bad reactions to it, and then document afterwards. Then I'm going to do hand hygiene again. And then apply gloves as I'm doing this here. Alright, so again, verifying that it's the 2 milligrams per ml of morphine, and it's for Jake Smith. He has no allergies to this medication. We're giving him 1 ml. So I'm gonna pull up the syringe to that and then place 1 ml of air into the vial. And then pull up 1 ml. back on to ensure that it stays sterile. And then place this in the sharps container.
What do you need? You got needles? You got drops? You ready for me? No, that's my name.
Alright, and so now we're ready to go into Mr. Smith's room. Knock knock. Hi Mr. Smith, it's Megan again. I was just coming back because I have your morphine already. Just letting you know it sounds like you've been in quite a bit of pain, so we're gonna give that to you to help relieve some of that. And I'll be around afterwards to monitor and make sure that there's no issues. Can I verify your name and date of birth again?
Yep, it's Jake Smith, 2287.
And then did you have any allergies at all?
Nope, no allergies.
Okay. Conduct hand hygiene again.
Yes, I think we do. So yeah.
And then I'll raise the bed.
Do I have to? Yes, I do.
And here again, I verify the medication with Lamar. It's the morphine 2 milligrams per ml. We're giving 1 ml for the 2 milligram dosing. It's being given to Jake Smith at 3:30 through his IV because he's in quite a bit of pain. All right, Mr. Smith. So this should help with the pain a little. I just want to make sure that if you're having any pain around the IV site that you go ahead and let me know just so that we can address that.
Okay.
So first thing I will do is I will go ahead and wipe the injection site for about 10 to 30 seconds and just ensuring that it doesn't touch anything else and then it dries before injecting it first with some saline. And first thing is I'll twist it on and aspirate to make sure that there is blood flow that comes back. And it looks like there is. And so then I will, first I would actually unclamp that and then aspirate, make sure there's blood flow, and then insert about 2 to 3 mLs. And then I will and then I would go ahead and get another wipe here and wipe that off again before I place the morphine. So again, it's morphine 2 milligrams per ml. We're giving him 1 ml. It should be injected across a 2-minute time frame. So we will slowly inject this, and while doing this, watching the site above the IV to ensure that there's no swelling or adverse reactions. And for time purposes, we aren't actually going to take 2 minutes. Alright, and then once that's done, we will use our other saline and flush this again at the same rate that we flushed the morphine. So 2 minutes, 1 ml. And then as we get near the end of this saline flush, we will clamp off the IV, ensuring again that there's no signs or swellings, reactions, etc. All right, Mr. Smith, how are you feeling?
I'm feeling pretty well.
Good, glad to hear. It sounds like the meds might be working a little.
Yep, I feel better.
Feeling any nausea, hallucinations, delusions?
No, not so far.
Okay. So I would stay with him for a couple minutes, just make sure that there's no immediate adverse reactions. I would go ahead and remove my gloves and perform hand hygiene. And then lower the bed. All right, Mr. Smith, so it looks like the IV and the meds are working out here well. I'm gonna leave the call light there. If you have any concerns in the next couple minutes, feel free to press that. And then I will be back in about 10 to 15 minutes to check on you just to make sure that the meds are still working and there's no issues with your IV. Anything else I can help you with right now?
Nope, that's it. Thank you.
Okay, thank you. And then I would perform hand hygiene again and leave the room.